we have a lot of newer staff that comes in and they're just kind of going off of count sheets based off of numbers, sometimes pictures. And that's huge because it takes a while for them to even get to know what the instrument names are as well. And if you don't really know that, it's very difficult without that assistance of others and or like computer system to figure out what is being requested. So I think really it's just kind of understanding again that workflow of maybe who's asking and what's happening.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now it's time to roll back and start the first case.
On this week's episode of First Case, we are speaking with Angela Benson, a sterile processing education specialist from Madison, Wisconsin. And we are talking all about sterile processing, the good, the bad, the relationship we have with them from the OR side and what they think about us from their side, and all of these conversations to really help grasp how we can better work together.
Yes, because guess what? Your instruments did not just become sterile by magic.
They did not.
Santa's elves were not down there in their magic toy shop. So buckle up because we've got a lot to learn from Angela about sterile processing.
Yep, so don't go anywhere. We'll be right back with Angela Benson.
From the studios of Healthcare HQ, you're listening to First Case.
Joining us now is Angela Benson, a sterile processing education specialist from Madison, Wisconsin. And Angela, thank you so much for joining us today.
I am very excited to join and have another chit chat and talking sterile processing.
I know. I'm excited to have you. And I love that you said another because that is true. You and I have chatted recently on the Beyond Clean podcast. I was the guest and you were the interviewer. So it's fun to flip the script now and bring you onto our podcast to really talk about the sterile processing role, because this season, as we're talking about collaboration, we're talking about all of the different departments that come together to make surgery possible, because behind our red line, we can get very, very focused with our blinders and think that it's all about us. But without everybody else, we would not be able to do what we do. So it's good to have these conversations to remember all of the people who are tirelessly making what we do happen. And also just understanding the importance of the job of sterile processing in and of itself. I think we could do a whole season just on how important you guys are. But we get an episode, so we're going to chat today. But before we get started, why don't you go ahead and just introduce yourself to everyone?
I am Angela Benson. I have been working in Madison, Wisconsin for the last 10 years, different roles in sterile processing. I started off as a technician and then went into a role as a second shift lead and then moved my way into education. I've been doing that now, I think 6 years, maybe approaching 7 pretty quick. It's hard to believe how fast it goes, but
right.
Some people know this about me. I actually started sterile processing when I was 13.
Really?
Back in the when you were allowed to just kind of hang out without any liability, I guess, concerns.
Yes.
Because
That's so familiar.
You're going to have to explain this. Please tell us, how did this come about?
It was a summer program that was for volunteens, and it was called Volunteen. I mean, it was barely a teen. My sister and I went in and saw this program. I was like, I don't know what this OR workroom thing is. I think it was even called that, OR workroom. And it just talked about, some sterilization or things. I just thought that was so cool to be near the operating room. So I signed up and just my little self, it really is hard to believe. Got into some scrubs and went and worked with some of the great ladies that were in the, I guess, reprocessing, but it was so like tight knit in the like a little core area with the operating rooms right around just across the way. There was a couple of them. So I got to do sterilization and wrapping and, handwriting on tape and doing the biologicals where you walked over to the lab to hand them off to get them. Anyway, I did that for about 4 years because not straight consecutive, a lot of volunteer hours, but
wow.
I did that because I absolutely loved it. And I really did think I was going to get into kind of the surge tech world, but once I got out of that just as a introduction and got into, paying and jobs in real life kind of thing.
Yeah.
I didn't get back to it for a while. And then, like I said, 10 years ago, I got back into it. And once I can't stop. So
it sucked you in and it's going to keep you.
It sucked me in as a young gal. And so it's been something that I know when I get passionate about it, it's a lot because of that. I think where I started off really young and understanding that behind the scenes, that help that you can do.
Cool. Yeah, that is so cool. And I don't think we've talked to anybody else on this show for all of our seasons who started anything healthcare related at 13. So I think you win the award for the youngest person getting into healthcare. Although Paul Wafer is a close second. If any of you listening, Paul Wafer was one of our founding members of the podcast. And he started out in healthcare as an orderly in the hospital. Like, I don't even know if he was out of high school yet. I don't remember exactly how old he was, but he went from orderly, worked his way all the way up to CEO, so like long experience there too. But I really do think he won the award for the youngest. So
absolutely.
That's really cool. I said, liability now comes into play because I'm going to tell you, when I was looking into getting certified before I got back into it, because I was like, I don't even know what they need. Nobody wanted to get me the hands-on hours that I needed unless I was actually employed at the hospital or through, a schooling and things like that. So unfortunately, I got hired and was able then to get my certification and all my hands-on once I got in. But it was a different world back then.
Yeah, definitely.
My aunt was an OR charge nurse at night in a trauma unit. And I used to go up there at night and sit at the nurse station and do my homework. And can you imagine these patients would be rolling back, but thank God they were on Versed, right? But I'm just a kid, like doing my homework and they're rolling back, seeing this like, young teenager with braces sitting at the desk. And I'm like, waving.
Hi. Well, maybe that's where you got your love of trauma because that's what you ended up doing was trauma. So maybe that's,
But yeah, no.
I just say bled off on you. That's a terrible pun at this point, talking about trauma, but it did.
Totally did. Yeah. Yeah. So I love that you had those opportunities. I mean, think about what 13-year-old, 14-year-old kids could be doing nowadays. The fact that you were back there being productive is just, it's awesome. I need my kid to go back there and do that kind of stuff.
And a huge shout out to my mom for taking us because obviously I was so young. I did it again for several years and my older sister then eventually started driving us when we would do it. Even when the program kind of shut down, they at least kept me on because they just couldn't resist me at my house.
Well,
that's so good.
That's really cool. So as we talked about this, okay, so you started in sterile processing at the young age of 13. But in general, talking about sterile processing as a whole, sterile processing has a huge burden of responsibility. Like there are a lot of things going on in sterile processing. So as we are talking about sterile processing, I think the best place to start is what is it all that you guys are doing?
It starts with, the easiest thing to say, as soon as that dirty case cart comes to us in sterile processing, there's a decontamination process. You're just kind of assessing everything, whether there's, throwaway items like single-use devices, you've got tray liners, things like that. You're doing all kinds of sorting to just, get that all prepared. And then you have your action, of course, of cleaning instrumentation. You're doing it manually. You're at the sinks. It's very hot and very, very wet kind of process. You're doing a lot of hunched over and brushing, repetition, things like that for cleaning. There's obviously the complex devices. You got so much robotic and really cool things out there that are making surgeries that much better, but it's just that much harder sometimes for our process in cleaning. So you're following a lot of the instructions that come with those, making sure you're doing it correctly. Then you got your, automation portion, your washer disinfectors, and then you just have the staff as well handling cleaning endoscopes at the same time as supporting outside clinical items that are coming through. Our facility supports a lot of a lot of different moving parts. And for us, it's primarily surgery. We're very heavy in orthopedics and sports med. Then once it's through, washers, you have a crew who are, prioritizing things, looking for what's the next day needs and or in the moment needs. And then you have your assembly going through, making sure the count's correct. Things are in an orderly fashion. That way, as you open it, you should be seeing the same thing each time. That way, for the ease of the next person touching it. And then, of course, there's the barrier. We talk about sterilization barrier, whether you're wrapping a set or you're placing into a container. Those are huge. That's another concern that can happen is your handling of things because, it's great that you can get this package nice and ready to go, but it's as easily compromised with just one little bump against something and creating a hole. And that can really be devastating, all of that hard work gone. Then there's sterilization, which obviously it's to me, the very critical portion of our job. You have, your documentation that's very important, what the set is, when it was sterilized, what parameters were met. It's actually a lot of numbers and things that you're just like, I don't even know if you would think about when you're coming into it, like verifying time and temperature, and your penmanship needs to be good. If you're, writing that out on a document, making sure you're not doing scribblies. And that is something interesting that you find along the way. People don't realize sometimes that the penmanship, because everything's so, digital,
write.
We're trying to go that way, but there's still writing that's involved. And then for us as well, we do then sterile storage. And we actually then do our own case cart picking as well in our facility. So it continues all the way to the point of the cart going right back to the OR and then starting that process all over again. And that's just very, very small.
And that's just
too.
like a day.
There's a lot of detail in there. And that's just a day. You're talking how many different specialties that we're handling too.
Well, good grief, it's so multi-layered and, you spoke about the OR, but that's just one department because you all, we use sterile instruments in the ER. We use sterile instruments in labor and delivery.
Yes.
We do procedures on the floor. And so that kind of daily interaction leads me to how important it is that you all communicate with those different teams. And because we depend on you so much and you all depend on us too, because there's a lot that we need to do to make your job easier. There's a lot that you all do that, all the sterile technique in the world doesn't matter if it didn't start sterile to begin with, So, so that's, first of all, I guess the main topic is communication. Like, what does good communication between those different departments in your department look like to you?
For us, we have a voice-assisted device that we utilize, and this is even just in the last couple of years. For a while, there was just the phone, the tethered phone, where you're like, I can't actually go look to see what you want because I'm attached.
I'm going to leave this phone hanging against the wall while I go look. I'll come back.
When they created these things, there are those wireless, phones anyway, without the cord, but with the assisted of that, it's just, kind of hands-free, voice activated. And that has been a huge help and support because we're able to communicate directly, whether it's the nurse, the scrub tech. I mean, we have groups set up on them. So that way you're kind of reaching the correct person who can do the running and support. That to me has been huge, where you're, again, not just picking up a phone, but your hands free and you're continually being able to look things through a tracking system and locate what's needed, or even Google what the nickname is that's being asked. That's another barrier, of course, is the lingo. There's some lingo that comes out where I'm sorry, what was that? And then you ask again, and you're like, which set do you think that would be in?
Yeah, what is that?
Just keep going. And then, and again, depending on who's taking that, you have your stronger ones that are, confident in talking with somebody and asking follow-up. Others are like, yes, of course, I will get that for you. Hang up and panic. And, so
it's Dr. Smith's favorite forceps. The one Dr. Smith always uses. The favorites.
Yes. Not that certain one because they don't like the grip on that one, but they need the one that doesn't ever exist and isn't made anymore. But I think that really that is really in the moment kind of that communication that can happen. And also in person. We actually see a lot of our staff come down in person, as we're situated right below the OR, and we have got the one elevator that you can go up and down, and there's a lot of other supplies being gathered and a lot of people coming and going, and just really having that opening, inviting kind of situation where it's not just like, we can't go up there, up into the OR, but we're actually very collaborative with, shadowing each other. And I've had many techs and nurses that I've gotten to bring into our department and tour around and talk everything out with, show every piece of what I just, talked about. And actually it's something that's very vital, I think, in that understanding. And you get a face to a name as well.
I think that's a great segue into more of this conversation, because you've brought the OR up into, or I guess in your case down, into your department. Where I work, it's up. So I'm going to say up, but wherever your sterile processing department may be, you've gone that direction to bring people in so that they can understand what goes on. I recently started working at a new facility, and I had to do a shadow day in sterile processing for a few hours. And at one point, I was elbows deep in a big case cart washing it out, because we have the big case carts, but we don't have a cart washer. We have two hands, and we're going to go wash the cart, So I'm cleaning out this cart and wiping it down, while there's utter chaos, carts coming in left and right, and people cleaning out dirty instruments. I mean, it's a whole bit of organized chaos that is very different from the organized chaos of the OR. And yet there's a system to it. And being able to see it and see how it works really does change your perspective on everything that's going on in that department. But even we can understand it all, and there can still be times where we just don't communicate, or somebody thinks that something should be done a certain way, and you're like, yeah, we can't do that, or whatever. So what are some of those sources of miscommunication that you see often between SPD and OR?
I think I kind of mentioned a little bit too, is nicknames.
Yeah, for sure.
Another big one that I like to kind of point out to staff, and I think I just came up with it, just observation for myself, is who's communicating. So the nurse is usually the one communicating when there's an active case going on, and there's just that much disconnect from the scrub at the bedside, and they're asking over to the nurse, and the nurse is calling and trying to ask, and they're talking then to the ones in the room, and you're like, I'm so sorry, what was that? Oh, I'm not talking to you. Or like, there's just that is kind of what happens quite often. And even if there's some angst or like attitude that comes across, I just try to explain, well, they're the kind of messenger to us, and they're not right there. And if they don't often go in that one specialty room, they might not know like the staff or what's going on necessarily, and they might not even know what they're asking for, and they could be pronouncing it completely different, and you're just like, just that to me is a really big one. Again, besides, I'm not really completely understanding instrumentation. We have a lot of newer staff that comes in, and they're just kind of going off of count sheets based off of numbers, sometimes pictures, and that's huge, because it takes a while for them to even get to know what the instrument names are as well. And if you don't really know that, it's very difficult without that assistance of others and or computer system to figure out what is being requested. So I think really it's just kind of understanding again that workflow of maybe who's asking and what's happening.
Yeah, that's a really good, I think, a good realization for those who have never had the opportunity to shadow in sterile processing like Melanie did at her new facility. Also for students, as an educator myself, we incorporated sterile processing technician into all of our campuses. And it's been eye-opening for those students who do that concentration, because they then have this huge understanding for like why washing their instruments as they go helps you all, or why why we are not going to open 5 sets to find one retractor, those kinds of,
come on.
Yeah. Because they understand the process, but there are a lot of people in the operating room who've not had the privilege of being down in your department. And so there are misconceptions for just the process for even what an instrument goes through before it gets onto their back table. What are the biggest misconceptions that OR teams might have about sterile processing, whether it's a process or staffing or anything? What is some of that you can kind of dispel for those who are listening?
I think one of the more common misconceptions is what we do isn't that difficult. Maybe it's just as quick as just wash it up and throw it in the sterilizer quick.
Yeah, just get it back to us. Yeah.
Just get it back to us. Because really there's a lot of that, sub-sterile setup still, mindset of just kind of rinse it quick, throw it in the sterilizer, kind of the flash of our
I got asked that just yesterday. Can we not just flash this? And I'm like, no, you cannot. A flash is not a substitute for the fact that we don't have enough instrument sets. We're not doing it. But sorry, that's my soapbox for another day.
But that carries through no matter what era we're in. I had that as well. We are, again, I was shadowing or touring around some surge techs, and that's what we're discussing and what that involves and what, shortcuts. But I think because of that kind of idea of just kind of quick and go, yes, there's shortcuts, but we never want to use them. And you want to think about who you're supporting. And, we say patients, but, I'm going to say even just a coworker or somebody who, if I'm doing something sloppy and if I don't do it right the first time, I could be, harming my coworker, just based on, where something's contaminated and it's not getting done correctly and going through, and someone with no PPE on in that assembly prep pack area, they're not going to be prepared for, that splash of something or things that are left over. But again, I think just that's to me the biggest thing for misconception, I guess. And because I have the ability to be able to kind of show around, honestly, students too. We've had it open for a lot of different variety of people coming through, even other departments in our hospital, whether it's facilities, they come through quite a bit and maybe don't really know what's going on, but just all of those moving parts. I know, again, going back to communication, I'm just thinking back when we were under construction for our sterilizers. And there was a day that we, out of our 6, I believe we had one running. And I don't know that the OR knew that. And they probably should have, because of the delay potential or the, you're really putting a lot of good, jinxes or whatever into that one to make sure that there's no errors, that you remembered your test pack and everything's set up right. We got through that day, but it was one of those all-of-a-sudden realizations, like when they're trusting us, that we're doing what we're needing to do. And even with all of the complexities of it, that if we're delivering it on time and in good condition, you don't realize that there's so many other things going on that could just take that one, little misstep and cause a huge delay. Fortunately, all our sterilizers, knock on wood, are working right now.
No, I was about to say, that's a hell of a day.
One sterilizer supporting how many ORs?
Yeah, how many ORs are you guys
14.
Oh my God.
It had to do with construction of the flooring behind the sterilizers. Again, another behind the scenes thing you would never think of. But the way the flooring was put in, it was buckling and it was becoming a issue with infection prevention. It was like, this is not okay. So there was a removal of that. There was new sterilization or sterilizers being put in. And so we had this big, beautiful wall up, this little barrier system. And I believe we had the 2 available. It's just one of the 2 went down in the process.
Of course. Of course it did. Because Murphy's Law says if it can, it will. Okay, so then we're thinking about that, and obviously that's something that should be communicated, right? We're like, the OR should know that, hey, this is what's going on. But also there are things that the OR can do to support you guys, especially when there's a shortage or there's like big caseloads or high surgical volumes or whatever. So what is it that you think that OR professionals can do to better support sterile processing?
I mean, at the start of it, the pre-treatment, that's a huge trigger for us. And pre-treatment's very big. We're actually doing initiatives to track and trace if it's happening or not, and working collaboratively with IP and also the OR, getting that, better compliance. Again, with heavy orthopedics, it's very messy. And
we are messy.
I don't see it being very compliant in the sense of, you almost kind of like, you measure out your pros and cons, like, okay, well, they did pre-treat it but there's still a lot of gross debris underneath
But
it.
my reamer's still loaded, but the reamer's loaded,
Correct.
but it's been sprayed with pre-cleanse. So
and you're like, yeah. So you're like, okay, and you move on. Because again, that's the delay of the compliance of it versus the let's get it done. Sometimes it's like, let's just get it done. So that's a huge one off the bat. But I do have to say the props to for our facility. We've actually had surge techs come and assemble trays with us. And when we've had a shortage of staff and or just the mountain of instrumentation that you just get buried under, because you are supporting every day's cases, but they're not all needing those instrumentations. And I think that's another thing that kind of looks crazy as to how can you have like 200 trays not assembled and how are we meeting the needs? Well, the needs change every day as to what's needed. So, you pivot every single day as now we need all of this, total hip instrumentation. So we're going to ignore the total knee for, things like that. So that assembly support has been great. A lot of the times they're coming in and setting up their specialty essentially. If they know general and they're sports med, they got this, and it's kind of a nice irony too, being like, well, if there's a problem with it, you can talk to yourself, and having that kind of flip side of something like, you forgot this. Well, that's on your initial.
Yeah.
That's been
make sure you clearly print your name on the wrap.
Exactly. Yes. That's been a great support as well. And also for, like I said, case cart picking, that those are areas that we've had that kind of joint effort. And even when we first opened our facility for sterile processing techs, we would go up and actually help with rooms as well. Just, turnover and things like that. It's been a while, but it's something that's still just trying to maintain even when staff changes and educators change and things like that, just trying to keep that connection happening. But I guess to me, just pre-treatment, I think everyone out there's probably like, yeah, pre-treat your stuff or clean your gross debris off of things, please.
All day long.
And the cement, please keep the cement off the instruments.
You just read my mind. I was going to say the cement's a huge one. Yeah. Yes, cement is very tricky.
Yeah, that'll put me on a whole other soapbox because before we started recording, I was with a student who had to deal with cement on a retractor and a preceptor who didn't handle it correctly, and my proud student did. Anyway, mom, happy mom moment.
Those
proud moment.
Proud mom moment. Yeah, but no, I get it. So once again, as always happens, we're going to get in trouble for going over time, but it's such a good conversation, right? But yeah. So as we're wrapping it up, we always want to say, give our guests the last, kind of words. But if you could share just one message other than pre-treatment with OR professionals about working with SPD and SPD, like what's your big takeaway? No pressure.
I would say kind of that the trickle down effect, how do you feel when you're in the room working with the surgeon and the staff and how they're treating you? Just kind of think of the fact that if you mimic it, if it's not positive and that gets put on to the next set of people supporting you, it really does make, for a bad day and a bad time. And if anything, trying to just change that attitude and having a better attitude. I know that I feel like sometimes daily with our staff, not having that, kind of judgment of those people upstairs. We all have our days, and honestly, we are affecting patients' lives, and we're not right at the bedside, but we definitely have, our impact in it for the surge techs and nurses and everyone in the room. It's just that much more critical and live in their face. So just having kind of that, just keeping that, I don't know, it's hard to say that positive attitude. It's like saying world peace, but let's have, some sterile processing OR peace. And that, I think the attitude goes a long way.
You are absolutely right. And I think you really, as we bring this to a close, hit on something so important, that you are touching patients' lives. Maybe it's something that feels like it's not in your face every day because you're not in the room. But what you do matters, and what you do directly affects what we do. And so realizing and understanding the value of the role of the sterile processing department in making what we do happen is huge. And so for the OR people listening, recognize the value that they bring, because without them, we wouldn't be doing any of this. So Anyway,
yes,
all of that to say, thank you for having this conversation with us today. And thank you for joining us. It was a pleasure to talk to you today. That was Angela Benson, a sterile processing education specialist in Madison, Wisconsin. And Chris, these conversations are so important because these are the conversations that help us bridge that gap, or, you hear the trendy phrase, break down the silos, whatever you want to say. But it's these conversations that help us to achieve those collaborative goals that we are all looking for. Because ultimately our goal is safe patient care, right? A positive patient experience. And all of these departments that we work with help us make that possible. And I think it's very important that we really grasp and understand sterile processing's role, because we could not be doing what we're doing if it wasn't for them.
No, I completely agree. And I think that is one of those departments that is so underappreciated. And I think it's because people just don't understand what it is that they do. And I love what Angela has said about the collaboration they're doing in their facility. And I think if more facilities would have those opportunities for people to come and shadow, like go meet your fellow sterile processing technicians. And then for sterile processors to come upstairs and see what's happening in the operating room, the better we understand each other and our roles, the better we're going to take care of the patient at the end of the day.
Yeah, absolutely. And, after we were done recording, Angela actually told us that she actually has the OR educator coming to shadow with her today in her department to learn and see what all they do and really get a grasp of everything going on in sterile processing. And then next week, she's going down into the operating room to see more, to learn more, because she said, I've watched surgeries, but I really haven't seen a setup, and I really need to see them count, and I want to see what this looks like. And that is the kind of attitude that we need from both the OR and sterile processing. I want to see how they do it. I want to understand, because when we understand, then we can actually work together and achieve these goals that we so desperately want to achieve. But we will have to have Angela on for another episode at another time, because there's way too much to talk about in one 30-minute section. So that is going to do it for today's episode. On behalf of Chris, myself, and our whole team, thanks for listening to this week's episode of First Case.
Thank you for listening to this week's episode of First Case. As a reminder, you can help support us by subscribing to First Case on your favorite podcast app, or by downloading the smartphone app on iPhone or Android. Simply search for First Case in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts, and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@firstcasemedia.com. We look forward to hearing from you.